Hi, Kitty.
Hi.
Thanks for joining me. We've been asked to reflect on the 2016 Digital Summit, which we just finished most of the recordings on, and we're going to be showing these episodes during National Midwifery Week coming up very soon. And so it was kind of fun to do because it was a lot of nurse midwives and midwives telling their stories. And there were also some clients and some of our staff, and so it was pretty fun to do. I thought it was really interesting seeing how nurse midwives are expanding their role by adding other certifications.
Yeah, well, particularly because we target rural areas, and in rural areas there are just not the number of providers that are needed to provide the care. So, and for a midwife, there's probably not even enough birth. There's certainly not enough birth to bring an obstetrician gynecologist into the area because he can't make a living. And so the nurse midwife has to think about her heritage at Frontier, about those nurses, we did everything. So what they now call family nurse practice, we did. We were public health nurses. We were sanitarians. We even were veterinary assistants for a while. You did whatever needed to be done. And nursing was a much broader education in those days. When I was a student nurse, I spent 5 months doing home visits with the visiting nurse. I saw everything kind of thing you can imagine. And they don't get that in nursing now.
No.
And they don't get any of that. And so we have to supplement with the curriculum, and that's why we have a separate program now, family nurse practitioner, so it encompasses this. And the beauty of this is when you're a midwife, the first mother that you register and you give her a whole year of care, you don't get paid until that year is up. And then they add 3 months or so, and they may argue about paying you at all. So how do you live without being able to? Well, if you are also do family nursing, you have an income because you're doing the school exams and you're doing, all the checks on grandma and papa and everybody that needs to be done. So when we, as Frontier, took on what Mary Breckenridge demonstrated for rural and underserved areas, we had to think more broadly. And so people say, why did you do all these other programs? And well, they don't interfere with what our recruitment of midwives. We still are very central to the fact that all healthcare begins with the care of the mother. And these other practitioners are added to fill out the care that a community needs for their multiple cares. So I think having the DNP, I have to confess that I didn't think it was necessary. I didn't think, I wouldn't go get a DNP. I can do the job. But the DNP is not just being a midwife, for example, and being able to do the job. It's being able to have a vision for the future and a mission, and to take some leadership responsibility in doing what needs to be done anytime you want to make change, which is you have to deal it at a legislative level, you have to deal it at a data collection and reporting level, all of these things which the ordinary practitioner every day doesn't think of.
Oh, you're so right. And one of the big exciting things right now is that we're adding the psych mental health nurse practitioner program. And we've had a lot of midwives say that they are being asked to take care of these patients, and they're not all that well trained. That's not in our basic curriculum. So we're excited to see that expansion as well. One thing I just did want to comment on, you are the one who really taught us over and over again that we should use stories to get our message across. And so I'm so proud that we actually have just taken this digital summit and just asked midwives, students, their clients, everybody to tell their story. And so I think in that way, it's a pretty exciting summit. So thank you for teaching us that. So with that, I think we're excited about this digital summit. I hope everybody comes to join us and watch, and we'll see. I hope they like it.
I hope they answer the call. Isn't that what it's all about? We want them to answer the call.
You're right.
We can do twice as many students as we're doing now, and we need to do that. We are capable of it. We know how to expand as the students expand, and if you want to keep the tuition down, you've got to keep the volume up.
Thank you, Kitty. We appreciate all your lessons always.